NTDs affecting the skin, such as leprosy and leishmaniasis, cause lifelong disfigurement and profound psychosocial impacts due to stigma. Globally, people with disabilities face a 1.5-fold increased risk of violence, with women being disproportionately affected. Experiencing violence associated with mental health issues, changes in health-seeking behaviour, and disease self-management, posing a challenge to disease programmes. The COVID-19 pandemic has also increased rates of violence globally. Despite this, there remains a global research gap on the relationship between disability and violence. Liberia is one of the first countries to launch an integrated management programme for skin NTDs, and Redress, a consortium at the Liverpool School of Tropical Medicine, have been supporting the Ministry of Health to develop the programme. Their formative research highlighted violence as an issue, and in response, this study aimed to explore experience of violence in people with skin NTDs in Liberia and identify opportunities to strengthen person-centred care. Data collection was conducted in 5 counties across Liberia, both in person and remotely. Our formative research consisted of a literature review and a secondary analysis of key informant interviews with people affected. Next, we conducted key informant interviews with professionals working on violence and disability services, as well as a set of remote vignette activities with patient advocates living with skin NTDs. Finally, we conducted secondary analysis of several illness narratives. We found that determinants of violence were intersectional and included myths around witchcraft, gender, and Liberia's history of conflict. Our research suggests that emotional violence is the most prevalent form, with sexual and gender-based violence also being common. However, the majority of participants reported experiencing overlapping forms of violence. Interestingly, while key informants were adamant that physical violence was the most common form, people affected stated that it was the most rare. Participants also highlighted healthcare workers as one of the perpetrators, and responses demonstrated that informal networks are a source of both support and violence. Coping mechanisms included peer-to-peer support, taking agency, and avoidance in the form of migrating or seeking healthcare at night, a mechanism that was very common among participants. We also found that violence is causing multifaceted health impacts, including internalised stigma, mental health issues, and challenges in maintaining employment and education, highlighting the importance of addressing the issue. Another key finding is that violence is influencing health-seeking behaviour. Participants highlighted numerous barriers, including concealment, high costs, and staff attitudes. These barriers are causing health-seeking delays, inaction, and engagement with the informal sector in some cases. This, in turn, is resulting in worse disease outcomes and inadequate adherence, as well as exacerbating internalised and social stigma. Based on these findings, we recommend that programmes focus on launching education, peer-to-peer support, and livelihood training. Programmes should also focus on support and mobilisation within communities. Finally, further research is also required. Overall, this project illustrated that violence against people with skin NTDs is highly pervasive, occurring at virtually every level, from the home to healthcare settings, schools, and the community. Individuals are experiencing overlapping forms, with emotional violence being most common. The impacts of this societal issue are profound and multifaceted, ranging from individual health impacts to gender inequity. Given these findings, it's vital that the integrated programme takes an intersectional, multi-sectoral approach, utilising informal networks to address violence against people with skin NTDs. Since conducting this study, Redress has also developed interventions for health workers at the facility and community level, and with informal providers to support the health and well-being of people affected. This includes a focus on combating stigma, and there's a link to the manual on the poster. Thank you for listening. Please do get in touch if you have any questions or want to talk about our research further.